Hey, my dear friends, you're welcome, dear listeners, and our friends around the world, in Nigeria and around the world. This is Vital Health International, a health conversation to help you eat healthy, live healthy, and feel healthy, and spend less money on doctors, on hospital fees, and on medical bills. It is my desire and our desire as we go on to help you live out your life on earth as God planned for you to live out. That's why this health conversation is coming your way. And I do hope that by the end of this program and in the subsequent weeks, you will learn a lot. Now, Vital Health International has been on the air for quite a while, but we have taken a long break, a long hiatus because of some of the other things that we are doing around Nigeria and around the world. But today, it has become necessary for me to come back on the air because of a new development, a new program that is coming your way that will help with your health, the health of your friends, and the health of your family members, including the health of some of your enemies who you want to die. But however, if they are owing you, they need to pay you before they die, okay? This program is called Telemd, T-E-L-M-D. And a good friend of mine who lives out in the U.S. has started this program. Today, she is with me in the studio to talk about this program, Dr. Toyin Okwelami. Toyin, you are welcome.
Thank you very much, Dr. Joe. It's nice to be here.
Oh, thank you so very much. I'm going to call you Dr. Toyin. Is that okay?
Yes, that's
okay,
great.
because I know that's what your followers and some of your patients call you around the world. Now, you are a primary health care physician, right? Good. And you are starting this program called Telemd. Now, tell me, what is your motivation for Telemd?
Really, it's looking at Nigeria and the healthcare system in Nigeria currently, seeing the need for primary care. Nigerians are more reactive than proactive. The average Nigerian will go, if you tell them, I went to see my doctor, they'll go, what happened?
What happened?
What happened?
You went to see the doctor
What
to get bad
happened?
news, eh?
Yes. So that shows you the culture in Nigeria. You don't go to see your doctor to be sure everything is well.
Okay.
So what we recommend, or what I'm hoping to bring to Nigeria, is the health education and the need for health care. So this is why Telemd is existing. We want to be able to take care of people, make access easier. We want to make it affordable, and we want people to become more health literate, not health illiterate.
Okay.
More health literate.
Okay, when you say health literate, what do you mean by that?
They should be aware of certain conditions that they might be predisposed to.
Okay.
Maybe because of lifestyle or because of familial inheritance.
Inheritance, okay.
Yes.
Okay.
And they should know how to manage and when to manage.
To manage, okay.
Yes.
Now, it's interesting you are saying that because I used to say that every individual is their own best doctor. You know how your body operates and what may be happening to you. And for some people, it's easy for them to pick that, hey, it looks like I'm not sleeping well. It looks like my going to toilet pattern has changed. It looks like I'm having some unusual headaches and all that. That is important, right?
Yes. So in medicine, there are things we call symptoms and there are things we call signs.
Okay.
So the patient can describe the symptoms perfectly. You cannot describe the symptoms.
That's right.
But the signs come from the doctor. The signs will be, oh, you're not sleeping properly. And I'm examining you and I'm saying that truly your heart rate is 110 instead of normal 80.
Okay.
And I'm asking, did you sleep well?
Okay.
Are you doing a lot of coffee to keep your eyes open? So yes, you might be your own best doctor looking at the symptoms, but with the doctor, the trained medical doctor, they can pick up the signs.
The signs, okay.
Yes.
Okay, now I noticed that this is a laudable program you're trying to run, and I commend you for that because I know it's taken a lot of courage and a lot of guts for you. Now, how did you come about this whole idea about Telemd?
Okay, so this is a story. I have two very dear people to me. One of them, like my big brother, has been saying, Tony, why don't you do this in Nigeria? Why don't you make healthcare accessible to Nigerians? And I'm like, Nigeria? That's a lot of work. I don't want to go there. So I'll smile. Then another one came and said, Tony, you can do this. You can do this. He is more about the business, about the money. But for him, he is very poverty conscious, and he was looking at how to make healthcare affordable for Nigerians.
For the common man.
Yes, for the common man.
Yeah.
So, so Tony brought in our medical sense. Tola brought in his business sense, making this
Tola
affordable.
is your brother, right?
No, he's not my brother. He's my partner.
It's your partner. Oh, okay.
Yes, he's one of the partners at Telemedicine.
Okay,
So
and you are Toyin.
I'm Toyin.
Okay, so you brought in the medical sense, and then Tola brought in
the affordability
okay,
sense.
and then I brought in the publicity sense.
Yes, but there's Francis who brought in the
accessibility
sense, yes,
okay.
and the empathy
Okay.
that we should try to do this.
Okay.
And that's how Telemd came to be.
Okay. Oh, well, that's great. That's great. But you had a conversation with me about something that happened during COVID, right?
Yes.
And how you thought.
Yes. So just before COVID, I was going through a lot. I just had a child, a baby, and he had a lot of respiratory issues.
Okay.
So I was looking for a way to balance being a mother, being a wife, being a doctor. I know people would say there's no balance, but I was trying to get it. So I decided to stay home, check it out to see if telemedicine would work. And I saw that it was good. Then COVID came and it just exploded. So I was like, this is something I can do. And working through this, after doing this many years, I see that, yes, I can still see my patients. We can still conduct some exam where the patient would examine themselves. I'll direct them.
Okay.
And we can still do labs. We can still do a lot of things to make diagnosis. So it's not something it's not something that cannot work.
Okay.
And the way medicine is going these days, we are all moving towards technology, being technologically, will I say dominant?
Yeah.
So a lot of things are going with, your doctor can be in Saudi Arabia, you're here,
Yeah,
and there's a
yeah.
machine examining you. Yes. So I can order labs, I can order imaging for you to do in Nigeria, and I get the reports back and I can make diagnosis.
That's right.
Yeah.
In fact, that has been on for quite a while, particularly some surgical procedures have been done remotely where a doctor is in one country.
Fantastic.
Yes, and then, is guiding the physician who is on ground or the surgeon on ground to do the surgical procedure. So essentially, a need that was in your own life translated into you now helping others. Now, there's this old saying, I don't know whether you still have it in these days, but I used to hear my mother say that necessity is the mother of invention.
Yes.
Okay?
Yes.
Yeah, so that gave you the impetus and gave you the motivation and the creativity. Now, you said something about ordering labs. Now, by the way, I'm sure some of you are wondering, how do I reach Dr. Toyin? I'm going to give you a couple of contact numbers, and I'd like you to write this down. Really write this down, because you may say you don't need it today, but you're going to need it tomorrow. Your friend will need it. Your family member will need it. Let me give you those numbers. You can reach TelMD on the phone 0707 660 7330. I'll take that again. 0707 660 7330. Now, you can also reach out on Instagram, IG, at TelMDNG. Tel, TELMD for medical doctor, NG for Nigeria, TelMDNG. On Facebook, you can reach her on TelMD. Facebook contact is TelMD. On LinkedIn, you can reach her on TelMD Nigeria. TelMD Nigeria. And in case you lose that, some of you have kept my contact over the years. Don't use the phone number to try to call me, because you're not going to reach me on that. But you can also send me an Instagram at Dr. Takon, at Dr. Joe Takon, at Dr. Joe Takon, Joe, T-A-R-K-O-N. And if I get that message, Dr. Toyin and her office will get it, and all the doctors who are working with her. Now, Dr. Toyin, you said something about doing labs for some people, right? That if it's important for you when you take ill, you want to see a doctor. Now, but there are some people who don't have any symptoms. And if you don't mind, I'm going to tell you about my own definition of health. I came up with this categorization to allow the common man understand levels of health. I call it levels of health, level 0 to level 4. Level 0 is where the person is healthy, completely healthy, there's nothing wrong. If we did labs on you, we wouldn't find anything. You're as healthy as a kitten, a baby, healthy baby, born in healthy circumstances, completely healthy. Then level 1 is where you may have some disease conditions. You mentioned something like hypertension. Some people have high blood pressure. They have high sugar levels. They may have high cholesterol, but they don't know. But they appear normal. The symptoms are not even there. You can only get that when you examine and you see the signs. Then level 2 is where, or not level 1, level 1, you see that. Level 2 is where there are some symptoms, and then when you examine, there are some signs. Let's say if the person has diabetes, the person starts feeling fatigue easily, the person starts, at complicated level, the person starts passing a lot of urine and things like that. Okay, that's level 3. You examine the person, you see the conditions, and then, the person complains, the symptoms are there. You examine the person, the symptoms are there. Then level 3 is when complications are beginning to set in, right? And then level 4 when it's terminal. Yeah. Okay. Now, so what do you suggest to somebody who feels that, well, I'm on level 0 or I'm level 1? I don't need to see a doctor. My case is not that severe. What do you say?
You just never know. There are people that work amongst us today, and because they've not seen their doctors, they seem to be in the greatest shape. They exercise, eat well, but you just never know. There might be something. It might be a lab that just shows that, this person has chronic kidney disease. Why do they have chronic kidney disease? It's already at stage 4. Oh, they tend to run a lot, and when they run a lot, because one knee aches, they know why it's aching is because of running. They use ibuprofen. Oh, ibuprofen. It affects the kidneys. But you do not know. And this has been going on for years. You're trying to.
Or they've been taking diet soda forever.
Yes.
Diet soda drinks. Yes.
You just see the legs start swelling. They can't catch their breath, and they go to the hospital, and they're like, the kidneys are not working well. And they're like, how did this happen? That it's somebody from the village.
Okay.
No. So that is one of the reasons why we encourage people at least once a year to see your doctor.
Yeah.
Do the test, find out. I know people will say, I don't want to know. That if I go, they'll find something. Let them find something. Be aware of the something. Get educated about the something. It's better to know than be oblivious.
Yes.
And then they will say slumping disease. It just
slump and they died. And they say witches.
No, that doesn't happen.
Okay. That's very good. So now, essentially, what TelMD will be doing, you'll be helping people make some of these early diagnoses, correct?
Yes.
Good.
Yes. So we are very big on what we call our wellness package.
Okay.
We advise you to do once a year. You get to meet with our physician who will talk to you. They want to know about your health, your past medical history, what has happened in the past. They want to know about your family medical history.
That's right.
Are there inheritances that you might be at risk of?
That's
they
true.
would look at your demographics. Are there things in the environment that might be contributing to your health, your lifestyle? They will look at your age, your sex, because there are some things that increase, or there are some risks that might be increased with the sex, with the age. So they'll look at all this, and they would order some labs, tell you to do some screening tests. Then you'll come back with the results. They get the results, they analyze it, and you have a discussion. This is what you have to manage. This is what you have to do. Or this is this diagnosis. Or, perfectly well, come back and see me next year.
Do you have to look at their politics? You know which party they are, political party they are?
No, we don't do that. No, we don't do that.
Because some political parties can contribute to or aggravate some.
I have friends that stay up all night watching news channel because they want to see what's the latest. They want to know what's the latest.
Yeah.
That's stress. Stress contributes to ill health. I tell people, read your news. Don't watch your
news. Okay. Read your news. No, I like that line. Read your news, don't watch your news, because when you watch your news, you
can't control what you hear.
You can't control what you hear, but you need to be able to control your health and control yourself. Now, there are some disease conditions that really come on people, particularly in our society, right? The Nigerian society is where there are some diseases that are particularly very pronounced, or they are very common, and people experience complications that I say could have very easily have been avoided. Now remember, what Dr. Toyin is trying to do is to create an environment where you can get early diagnosis, and in case you have a disease condition, either stage 1, stage 2, what I call my own levels of health, level 1, level 2, level 3, you can get good treatment. And God forbid, even if you are in level 4, where it's actually terminal, I'm sure her team will counsel you on how to transit this earth in a way that is dignifying, and it's a way that is reducing or minimal with minimal pain and minimal complications, regardless of whatever the complications have been. Now, there are some disease conditions that we see particularly in our community. One of which is hypertension, right? Yeah. We have other diabetes. We have people who suffer stroke. We have different, infectious disease conditions and all that. Now, what would you say to people who have hypertension? We'll define hypertension very quickly. But what would you say to somebody who has been proven to have hypertension, but does not think that it is necessary to get medical attention?
We have a health fair in Nigeria about 2 months ago, and I met people. There was this particular woman who I met, her blood pressure was through the roof. She was still walking around happy. She said, nothing they do me. But her blood pressure was high. I was like, do you have headaches at times? She said, yeah, once in a while, then I'll sleep and I'll feel better. I was like, well, see, your blood pressure being high, just imagine, it's like your organs needing a soft flow of blood. Usually that's the normal blood pressure, but that because your blood pressure is high, it's not gushing like a tap. After a while, something starts to chip away, something starts to wear away. It's not normal. That's not what your organ needs. So you can only dwell like that for a while. After a while, the body starts to develop complications. Yes. So when people have high blood pressure, I want them educated. What is high blood pressure? Why is this happening? Okay, what can I do on my own to make sure this blood pressure is well controlled and is staying controlled? Okay.
Now we're going to go into that because I'd like us to really explore the conversation on high blood pressure a lot, because high blood pressure is such a problem in the society. I had done quite some studies on high blood pressure within the Nigerian community, and before we talk about that, one of the things that have been reported by health professionals, the WHO and all that has to do with non-communicable diseases, okay? And we have realized that about 70% of non-communicable diseases are actually the product of lifestyle modification. Yes. Good. So what has been your experience in that?
Yes, so it's our new Western lifestyle. Not just, I wouldn't just say Western.
Okay.
It's more, we are more mental these days than physical.
That's right.
In the past, our forefathers, they went hunting, they got their food and brought it back home. But now we sit at the table sedentary, and we transact, we do everything we have to do, 8 hours, and then we go home. Yeah. Our bodies were not built like that. We're not built to function like that. So in being sedentary, and then you are sitting there eating, and you are eating the quickest thing you can get because you can't afford to get off your chair to go and look for food.
That's right.
So you're probably not eating healthy. So all this is adding up. And this is what we call the evolution of lifestyle diseases. You're eating unhealthy, you're sitting sedentary for 8 to 10 hours a day. And even when you do get to work out, you might work out 2 hours and then you go veg out, you sit, and then you might give yourself rewards. So at the end
in rewarding you cancel out whatever benefit you had by working out. Yes.
So at the end of the day, we see this evolution of lifestyle diseases. Some of them are like the hypertension, some are things like diabetes, hyperlipidemia, or high cholesterol. Yes, so these are things we are seeing in the society now. And then obesity, let's not forget obesity. This is a big thing because obesity can cause all these things I've mentioned and more. And it even puts you at risk for some cancers.
Yes. Okay, so essentially, and this is, if you remember, this is something I talked about a lot in my program, lifestyle modifications, how you can take care of yourself, because at the end of the day, even when you see a physician, you see a doctor, you go to the hospital regularly, whatever is being prescribed for you, the medications they give you, if you're not compliant with your medication and you do not effect the necessary lifestyle modification, nobody's going to help you with that in terms of sleeping well, in terms of eating well, in terms of being mobile, being active. You don't just leave home from an air-conditioned house, enter an air-conditioned car, drive into an air-conditioned office, sit on a comfortable chair, roll the chair from one part of the office to the other side of the other office, your food gets delivered to you, you eat in an air-conditioned office, and then you move back again into your air-conditioned car, back into your air-conditioned home, and go back to your air-conditioned bed, and things begin to happen in your body, and then you wonder why your body is falling apart. Lifestyle modification is huge. It's huge. Now, remember, you can reach Dr. Toyin on 0707 660-7330, 660-7330. Okay, now what we're going to do right now, because I want us to, if we are going to be helpful to our people, if you're going to be helpful to your people, there are things that you need to talk, we need to address some of these conditions, these health conditions, deliberately and specifically, right? The only thing that will not be done, what Dr. Toyin is not going to do, is to give you prescription over this platform, because it will be important for you to consult appropriately so that you can be given a proper diagnosis can be made, labs ordered if necessary, and then proper diagnosis is made and your treatment is initiated.